Hi, I'm Verna Smith, and welcome to this edition of Issues in Focus. Yes, it is another hot August week, Arizona hot, desert type of climate, and in the words of Congressman Barney Frank, on what planet do you live? On making that reference to that quotation is to say to you that I fully understand that healthcare reform, and I'm sure you understand that healthcare reform, the battle continues. Who would have thought that the month of August would have become the defining moment, so as to speak, for the Democrats in terms of whether or not President Obama will get one of his major campaign promises enacted, as in universal health care with a public option. We're not talking single payer anymore, because we've come to understand that it's not possible and it just might not happen. But of course, we have been building up to what most of us have been asking for and is anticipating a public option. But at this stage of the game, the week of August 20th, we are not sure what it's going to be, because for reasons that I don't understand, the Democrats have been caught flat-footed. That's the word being thrown around, because they never thought the Republicans would have come out not only saying no, but with a vengeance, taking them on and just saying it's not going to pass. The last time I heard, Senator Grassley, Republican of Iowa, was saying to pass any such bill would take 80 votes. Since when? I thought it was 50 or 51 with the vice president, whoever the vice president is, breaking the tie. There are 100 senators. How do we come to need 80 votes to pass any piece of legislation in the Senate? Could someone please educate me on that? But let's face it, all of this is about politics. Let's not kid ourselves. My concern is that healthcare reform, in terms of how I know it, I once worked in the field. I once worked as an administrator in healthcare administration, and I know that the current system that we have is unsustainable. The president has said to those who are fearing what might happen to them, we have heard of the dead panels. I referred to that last week. I won't go into that again this week. But for those who continue to fear that they'll be sent off to the woodshed because of dead panels, come on. This is a civilized society. The United States of America is a developed country. It's not someplace hidden in an equatorial forest somewhere. These are modern times. The president has reemphasized again and again that those who are happy with what they have don't need and will not need to change anything. So I want for you to close your eyes, if you're one of those who are fearful, to what you are hearing out there, because it makes no sense. What he's trying to do is to get that 50 million uninsured to have some coverage, those people with pre-existing conditions to get some coverage, and those 20 million others who are holding 3 and 4 and 5 jobs and still have no insurance, for them to get an opportunity to have some insurance in the marketplace. What we're trying to say, with a public option, we can make the healthcare competitive for everyone, not just for the insurers, which now have the monopoly, so to speak, in determining who gets covered. Let's not kid ourselves. People are talking about rationed health care. It's rationed right now. When you have a major procedure to do, you have to call the insurance company ahead of time and tell them what you're going to do and wait for their approval or disapproval. What do you think that is? Just walking to the door and say, this is what I want, and it happens? As I said, I won't beat this as a dead horse. All I can say, President Obama is in the executive branch. We have some blue dogs in the Senate, but nevertheless, Democrats have 60 votes in the Senate, and they have control of the House. They need to use the remaining days in August and whatever day in September they have to get together and pull forth a bill or a piece of legislation with a public auctions with no co-op. Co-op is nonsense. That speaks to the needs of the American people. Politics is about the greater good for the greater number. When, since has that changed? Politics has been about the major party goes in, and when they have the three houses, they are in a better position to bargain. So why is the bargaining on the Democratic side so, as they say, flat-footed, so weak-kneed? I don't have all the answers. Probably you do. But again, join me this week on my blog, vernasmith.com, where I will once again, for yet another week, talk about healthcare reform, what people are saying, what the fear-mongering is doing. Leave me a comment on this video. Again, leave me a comment on this video, or please stop by my blog. Take a look at it. I'm not popular yet. I'm trying to get to you, and I want you to get to know me. Stop by my blog, vernasmith.com, and leave a comment. As I said, it's hot where I am. It's summer. The dog days of summer are here. And again, for my topic of the week, it's the Democrats. Will they take control of the message? The Democrats. Will they boldly draw a line in the sand and say, this is what we want for people, and we are going to get it? It's the Democrats. Will they not be weak-kneed and seem to be bargaining and overthrowing their hands? Who likes in a war to be compromising with people who are always overcompensating, overextending their hands? It's never seen as a sign of strength. It's always seen as a sign of weakness. But hey, I'm not from the London School of Economics. Neither am I from the Kennedy School of Politics. I'm just from the Maxwell School of Citizenship and Public Affairs. And the politics that I was taught said, at some point you have to put your foot down, bite the bullet, and go for what you want. That is politics hardball 101. So again, this is Verna Smith. This has been Issues in Focus. Look forward to talking with you next week. Keep cool, and as I said, hold your senator, your congressperson, your president accountable, because without health care, we have nothing as a nation. Again, I hope you're living on this planet, and wherever you are, it's cool. I am Verna Smith, and this has been Issues in Focus. Have a good week.